When we're seeking out a buying decision, quite often we're conditioned to get opinions of other people, to conduct reviews. It's standard operating procedure, right? We want to talk with people that have bought. If we're signing a contract in business, we want to get referrals, references. We want to check, do our due diligence, right? And that's standard operating procedure in business, and and today in the information age, it's standard operating procedure for consumers just buying regular products every day. Uh, it doesn't happen in healthcare as much as it should, and it's unfortunate. And I'm flabbergasted that it doesn't, uh, because there's no more important decision that we're going to make when it's affecting us or one of our loved ones. But it's part of our psychology, and that's something that we have to come to grips with. We have to, if we're uncomfortable in a scenario, so you've got to really kind of think about what the possibilities are for not asking these questions. If you're given some bad news, there's a tendency to bond with the professional who's given you that bad news. You're going to have this procedure. You've got this disease. This is a treatment plan. We've got professionals in place here. I've done a lot of these procedures. You're okay. But do we think to ask about how many of these procedures have you done? Can I speak to a patient that's had success with this procedure, where you've performed this surgery? That's probably not going to happen. But those are things that we would normally do, right? Where did you finish in medical school? What are the leapfrog ratings of the hospital where you'll be performing this surgery? Basic questions we want to understand, and nothing more important to know going in, but a lot of times it just doesn't happen. And sometimes people just are left without options. So that's the most important thing to do as a consumer, is have options. I'm going to tell you a story about a woman who was given no options or acceptable options, and she refused to take no for an answer. So this is at my former agency. We got a call from one of our clients. They had a spouse who was dealing with a very rare condition. She was pregnant with twins, and it was called twin to twin transfusion syndrome, where the blood flow was passing through one twin into another and had the potential to cause organ failure for both, where the donor twin, the initial, was not receiving any of the appropriate levels of blood flow. So very, very serious, right? And unfortunately, her OBGYN told her, look, I'm sorry. We know this is hard, but there's nothing you can do. We're going to have to terminate the pregnancy and try again. And she said, look, I'm not going to let my babies die. And so we got this call. This insurance plan did not have a medical concierge in place. She had sought out some opportunities through the insurance company, but really all they were doing was referring her to in-network physicians, specialists, OBGYNs, not really focused clinically in this area. So she ended up going to Boston Children's Hospital, which in New England here is probably the best place to be. The gentleman who was very experienced here with this condition had just retired. They advocated for her at Boston Children's Hospital, and she went about 40, 50 miles away to Providence at Women and Infants Hospital. But they felt that the procedure was too advanced. And hats off to both Boston Children's and Women and Infants, because they were continuing to advocate for her. At Women and Infants, they said, there's the top person in the country happens to be in Tampa. And so what did she do? She hopped a flight to Tampa and delivered the twins. Now, it's 2025. Those boys turned 21 years old this year. All right, so these things can be life or death. In this situation, it happened to be 2 lives or 2 deaths. So sometimes we got to accept bad news, but not always, right? It's worth ruling out all these possibilities, even if it's an elective procedure. Maybe there's a way to figure out if there's a less invasive way to handle what we're dealing with, because there's nothing that's more important than that. So think about this story. If you're dealing with something yourself, or somebody that's just getting some news that they're uncomfortable with and not really getting anywhere in the healthcare system. It's okay to push back. It's okay to ask questions. That's what they're there for. You need to get comfortable with being uncomfortable asking those questions.